Hi, I'm Meg.
And I'm Megan.
And
this is Special Collections Roadshow. Where we'll be pulling artifacts from the archives
and sharing their stories with you. Hello, and welcome to Special Collections Roadshow. Today, we have a special guest with us. This is Dr. Ian Isherwood. He's from the Civil War Institute, and he's going to tell us a little bit about Civil War medicine. So based on the new PBS series, Mercy Street, we have a few instruments here that would have been similar to the ones portrayed in the series. So would you like to tell us a little bit about them?
Yeah, that's fine. First of all, Meg, thanks for having me on the show. I'm a big fan of Special Collections Roadshow, and I think the work you guys have been doing has been great. What I want to do is point out a few 19th century surgical instruments that we have seen versions of them in the show. We've seen types of operations in the show Mercy Street, and we have some instruments here that represent kind of those operations. So over here we have two surgical sets. One is English, the other one's American. Both are 19th century, mid-19th century surgical sets. And within those surgical sets are instruments for doing various things. And of course, most people know, if they know anything about the Civil War, they know that amputation was a major operation that was done, usually as a result of major tissue damage or bone damage to a limb of a soldier. And in the first episode of Mercy Street, there was an amputation being done in the operating theater, and here is an amputation knife and an amputation saw, similar to the type that you would see in the show, and both dating from the mid-19th century. There was also an interesting operation that was done, which is called a ligature, which is the tying off of an artery. And we have an instrument here, which was portrayed in the show. It has a little hole in the end in which you would put a piece of silk thread through, silk suture thread through, and then tie off a blood vessel with it after kind of curving it around the blood vessel. And that was shown in that very graphic nighttime scene in Mercy Street. It was shown rather effectively. In the second episode, we saw an operation which is called a trephining operation, and it's a type of skull surgery. This type of operation was reasonably common during the Civil War. It was not entirely uncommon during the Civil War. The medical and surgical history of the War of the Rebellion has about 30 pages of case studies of this operation being performed. And here we have the instrument that, a type of instrument that was used for it. It's called a trephine, and it's a little circular saw to be able to cut a small hole in someone's head to relieve intracranial pressure due to hemorrhaging usually. So that's a trephine, which you would have seen in that second episode of the show, and much of the drama between Doctors Hale and Foster was about whether you should drill the hole in someone's head or not, and that's the type of instrument which you would have drilled the head. And here's a representation from the medical and surgical history of how that operation would have been done.
So Dr. Isherwood.
Yes, Meg?
How would our audiences, if they're interested in researching more on Civil War medicine, go about that?
Well, that's a good question. I'd recommend beginning with kind of a secondary source, a general book that's come out in the last 20 years or so on Civil War era medicine. There's no shortage of them. We've put a few over here, some books that have come out, one on women in the Civil War, one a general history of Civil War medicine, and then Shauna Devine's book, Learning from the Wounded, which is one of the books that I think is represented pretty well in the themes of the show Mercy Street. I'd recommend starting with a secondary source like that, a more contemporary book by a historian having to do with 19th century medicine or Civil War medicine in particular. And if you're really interested in doing further research, then you can take those secondary sources and do more digging into primary source documents, which are documents that come from the time period, and there is no shortage of interesting case studies or documents that come from the Civil War era. Meg's going to hold up one. This is an example of a primary source. This is a memoir. It's the medical recollections of Jonathan Letterman. Jonathan Letterman was medical director of the Army of the Potomac, and this is his memoir about his service in the Army of the Potomac. And there are other Civil War surgeons that wrote memoirs or edited collections of letters that have come out in the last few years. We also have surgical manuals from the era. And these are particularly interesting because they demonstrate how surgeons learned how they would perform certain operations. And they're written in kind of a straightforward way. I've pulled a few examples here, and some of these manuals have been reprinted, so you can purchase them through Amazon or through bookstores, which is very interesting. And these are both reprinted surgical manuals here. But here's one which explains how you would do a ligature operation, the same type of operation we were just talking about. Here's a page open that explains in kind of very clear language how you would do that type of operation. In this manual, you see a large amputation knife, similar to that one, cutting through flesh, doing a circular style of amputation. And this medical textbook explains exactly how to do that type of operation with 19th century tools. So these are great resources too to be able to understand exactly how Civil War surgeons learned, how they understood, and how they figured out kind of their job as they were doing it. There's another type of source that I think is really important, and that is the medical and surgical history of the Civil War. This is kind of the official history of the medical department, Union Medical Department during the war. It's a multi-volume set. A number of libraries have it. You can see there's volume 1 there. I have volume 2 open here, which is open to the reports from the campaign on the peninsula in 1862. And that's the campaign in which Mercy Street is set. So Mercy Street is set in the spring of 1862. These are medical reports from the front from the spring of 1862. And you can go through, you can read about what medical directors are saying about the struggles of kind of manning field hospitals or manning general hospitals during the war. And they have lots of case studies as well. So there's case studies on amputations, case studies on trephining operations, case studies on treating different types of diseases and ailments. So it's a wealth of information for people who are interested in Civil War medicine.
So if you're interested in doing more research on Civil War medicine, make sure to check out some of these books that we featured in this specific episode. So Dr. Isherwood, what do you think a collection like this is worth?
Well, Meg, I think it's priceless.